Hello and welcome to the Fertility Signs Masterclass. My name is Kyra and I will be your host today. I am so happy you are here and so glad to be able to help you discover three of your body's biggest clues into your fertility and what that means for confident conception and so many other things in life. Let me tell you a little bit about myself. I am a nutritional therapy practitioner and I specialize in preconception preparation. I have a passion and a purpose for helping women and couples optimize fertility so that they can live in the most life giving and fruitful way. And for me, fertility means a few different things. It does mean, of course, the ability to get pregnant, stay pregnant, and to have healthy children. But it also means loving life, having vitality, stamina, libido, and feeling really, really good in your skin. The reason this is one of my passions is because I have not always been what I would consider fully fertile. I have experienced a lot of ups and downs in my health, and the way that I live now and the way that I experience and am able to show up for life is why this is so important to me to help you learn. When I am not working one-on-one with clients, I am hanging out with my two kids and my husband, and usually hiking, loving life, or setting up a tent somewhere to camp. Without further ado, let's jump in to our three fertile signs and how to track them. So, your body has this amazing capability of giving you all the clues and messages it needs. This is something my clients hear me say a lot, but symptoms are messages, and your fertility signs are big clues throughout your cycle and throughout the month, telling you exactly what's going on in your body. And the more that you can learn about them and be able to really observe them, the closer and more in touch you will be with your body, figuratively and literally, and the more you will pick up on messages. So that means when things are out of balance, you'll also know they are out of whack, out of balance, and be able to maybe scale back, make some tweaks and changes before being ill. If you already are aware that your body's out of balance, it's okay. We've all been there. Where you're at right now is the most important. This coming back to yourself and wanting to get in touch with your body's intuitive knowledge is the key starting point. So, I want you not to focus too heavily on any one specific sign. These are meant to be observed together and give you a bigger whole picture of exactly what is going on. Anytime you're feeling stress, anytime you're feeling like you're getting maybe overworked or too holding on too tight to one specific sign, I want you to take a step back, take a breath, and just observe a little bit more. So, the first sign that we're going to dive into today is your waking temperature, otherwise known as your basal body temperature or BBT. So, your basal body temperature is your body's resting temperature. It is what your body, right when you wake up in the morning before you have done anything else, will be at. So, before you're getting up to get a drink of water or even, kissing your partner, whatever it is you usually do when you wake up, the first thing you're going to do now is reach over to your nightstand and grab your thermometer to take your temperature. So, for most women of childbearing age, without any significant endocrine issues or things like that, most of the range of temperatures prior to your ovulation, so in that follicular phase of your period before ovulation, you're going to have a temperature ranging from about 97.0 to 97.7. After ovulation, this range will go higher. That's due to a change in hormones. So, as your follicular phase comes to an end and your body prepares for ovulation, and your luteal phase or preparation for possible pregnancy, estrogen plummets and progesterone will rise. And that is what gives you this increase and big jump in temperature that we're going to be tracking. So after ovulation, your range is going to look more like 97.8 and higher. Again, this will vary, of course, just given you and your individual body. The rise in temperature will remain high until your next period if a pregnancy does not occur, so about 12 to 16 days, depending on the length and strength of your luteal phase. And if you do become pregnant, this will be one of the first signs you'll see of possible pregnancy because that temperature shift will remain high above the 97, usually 0.8. And that will remain, if you are pregnant, high all the way until just a few weeks before you give birth. So one of my favorite aspects of basal body temperature is the clues it gives about your luteal phase. So to tell you a little bit about this phase, this is your phase immediately following ovulation and before your next period. And really, for a lot of us that have struggled with fertility, the luteal phase becomes the number one thing we want to optimize. This is when our progesterone really needs to be high and that human incubator action starts. So you can imagine that if you're having a very short luteal phase, maybe because of low progesterone or high cortisol, different things like that, then you will not have the ability to really confidently conceive. So I love the way that your basal body temperature so clearly shows you exactly how long that luteal phase is. A little bit more about basal body temperature. I've included a photo here of kind of a general day-to-day graph. Especially as you start to track, you might be kind of up and down throughout your follicular phase, and then you will see where that little red arrow is. That is the big jump up that happens after ovulation, and then you see the temperatures remain high until the start of the next cycle where they come back down again. So one of the reasons that basal body temperature is not relied upon on its own in order to track your fertility is that this temperature shift does happen after ovulation. So you can imagine that if you're trying to really get nailed on your most fertile day, you're going to possibly miss it because that temp jump doesn't happen until after ovulation. That is why we combine this with our other two fertility signs in order to get the prettiest, most perfect picture of when we are most fertile. What this does tell you, though, is when you are ovulating. So this is something really amazing to keep in mind because, especially when we're trying to conceive, to have a late period is extremely emotional. And a lot of times it's not that your period is late. I'm talking about if you're not pregnant. It's not that your period's late. It's that you actually had a delayed ovulation. So delayed ovulation happens for a variety of reasons, but long story short, it's often because of some type of stress, travel, illness, emotional thing, big shift in your life where your body says, you know what, you seem kind of busy. Let me just put this on hold for a second. But if you're not tracking closely your fertility signs, you'd never know that your ovulation was delayed. So then you're sitting around waiting for your period and it's 2, 3, 4 days late. And it can, of course, get your mind spinning and running, both, for some people negative and some people positive. So when you know your temperatures, you also know when you ovulate, and then you don't have to second guess if you have a late period. Some factors which increase waking temperatures. So these are things to keep in mind. If you do see a big increase and you're thinking, well, this isn't right, I'm not around ovulation. Any illness, fever, of course, but really just feeling crummy in general will change that waking temperature. Alcohol consumption the night before. I don't really know what the cutoff point of this is, but I'm gonna go ahead with more than one drink could affect your temperature. Your endocrine system is very sensitive, and alcohol, of course, throws that off whack, which we've all probably experienced. Less than 3 hours of consecutive sleep. This is a big one, especially if you have other small children. If you're waking up and getting out of bed or coming fully awake, drinking water, things like that, you might have a little bit of a temp shift. This is why it's so important not to stress out about one specific day's reading. This is something, again, you're going to want to look at a whole cycle at a time, a whole month at a time, and even months at a time as you continue tracking this and continue learning more about it. When it comes to timing, this is something that I get a lot of questions on. You really are just looking for the most consistent timing of taking your temperature. So, for instance, I usually wake up Monday through Thursday at 6 a.m. Friday, Saturday, and Sunday, I tend to sleep in usually till 7. A difference of an hour is not going to throw my temperature off too much. But if you're someone that wakes up extremely early, most days, and then maybe on Saturdays you sleep in like 2 or more hours after that, that could definitely sway your timing. Just use your head. If you know that you don't ever usually like wake up at 10 o'clock in the morning, but you did this day, like just know your temperature might be a little bit off. So keeping that in mind when you're looking at that. Another factor that can throw your temp off is external heat. So if you are not usually someone that sleeps with like an electric blanket or a heating pad and you decide to one night, just know that that could definitely affect your temperature. And keeping in mind that the entirety of your temperature is your body, like I said, it's a result of hormone shifts happening. So it happens for a reason. And if you are not seeing a pattern of temperature shifts, that means that we have some endocrine issues, which is in nutritional therapy. That's something we dive into. That's something we can heal and work through. So no need to be stressed. Everything has a purpose and a plan. So what are some tips for taking your temperature, and what are my favorite benefits? Well, I've already touched on the fact that you know exactly when you are ovulating. You get to learn exactly when and how long your luteal phase is. You get to have an idea for sure of when a good time to have sex is to get pregnant, and also maybe a not so good of a time to have sex to not get pregnant, So this is a great form of natural birth control when used with the other signs. While you're getting to know it, I would not rely solely on this, but it definitely is an awesome combination with the other signs as natural birth control. You also will know exactly when you will be getting your period, so you can plan events and things like that with a plan and a purpose. And you also, I think this is one of the number one ways, like I said, to diagnostic yourself. Like if you are having issues, you're not seeing a pattern, it's a great way to know something might be up with your hormones, something's up with your cycle, without going through a bunch of hormone testing or anything like that. You can get a pretty good idea of how everything is working just by seeing what your rhythm looks like. So again, you're going to want to take your temperature first thing in the morning when you wake up. You can use a specific thermometer for basal body temperature. If you want to get really specific, it has an extra decimal point. The resource I will give at the end, which will give you like an app and a charting idea and things like that. I believe you can order a thermometer off them. You can get it off Amazon. I personally use a traditional oral thermometer, and it does not have the extra decimal. I have used those in the past as well, but now that I've been doing it for a little longer, it works just fine. And like I said, this is orally. You can take your temperature vaginally. I don't necessarily recommend it just because, I don't know, to me it's a little bit excessive, but whatever, some women like to do that because they have a more precise temperature reading. Orally works just fine for me. You're not going to want to use like a lasered thermometer. You're not going to want to take it under your armpit. You don't want to take it like on your forehead, like a scanner one. You really want to use like the traditional under the tongue in order to get the most consistent and actual reading. Again, you're going to want to try to take it around the same time every day, at least within an hour, and be consistent. It's the best thing I can say. The more consistent you are, the more readings you'll have, and the more of a pattern you will start to see. Okay. So moving on to, we talked about this, strength and length. Yep, awesome. Moving on to our second sign is cervical fluid. So the more knowledge you gain of your body, this is something I really believe and just want to remind you of. The more knowledge you gain of your body, the more astonishing life becomes. You begin to look at everything in your health differently once you understand your body, and your fertility is no different. I think as women, anything that comes out of us is like, oh my gosh, we don't talk about it. And cervical fluids is no exception. One of the biggest things that I have learned from my studies and from really becoming an advocate for women's fertility is like, why are periods considered gross? Like nosebleeds, people don't get grossed out by. Why is cervical fluids called discharge? Like discharge should only be used when we're talking about a negative thing, like an infection. You don't have to think of what your body makes as a normal, healthy, fertile woman as gross. And anyone that makes you feel like it's gross probably shouldn't have a super close spot in your fertility journey or maybe in your life. But that's my own opinions. So when we're talking about cervical fluids, there's a lot to keep in mind, okay? Again, I want to reiterate, we're all individual. Nothing's going to look the same for everyone, but cervical fluids are a totally normal fertile fluid. They are similar, if you need a context to think about it. If you want to think about a man's sperm, right? Men are fertile every single day. So yeah, they have it easy that way, but their sperm is always fertile. So it's always the right consistency, it's always the right medium, and it's always like ready to go. Women are set up to not be fertile every single day. We change throughout the month. We have a cycle and a rhythm and a season that we go through throughout the month. So our fluids mimic that. So when we are not fertile, our cervical fluid is non-fertile, which means it doesn't support sperm motility, function, and nourishment the way that a fertile fluid does. As we approach ovulation, that is going to be life-giving to sperm. It's going to alkalize the vaginal tract on the way to the egg and really just support that sperm journey. So that's how I think of it, is non-fertile, fertile. It's going to be all, everything has a fluid, but it changes in what its consistency is. And the consistency that changes is because it becomes more or less fertile. So let's talk about the pattern of cervical fluids, okay? So most of us are going to kind of follow this wave idea of the dry to sticky to creamy to egg white, okay? Dry is going to be right after your period. So how I think of it and how I read in the amazing book, Taking Charge of Your Fertility, when we talk dry, we're talking a slight moisture. It's not wet. It's similar if you take your finger and pop it on the inside of your mouth, of your cheek. It's wet, but it doesn't like stay wet, right? It's just mostly dry. So what happens, this will stay dry until your estrogen starts to rise, and that is when the point of change happens. So this is when you go from dry to more of a sticky, also referred to as like flaky or springy. This will be at the end of your follicular phase. As you're coming into your ovulation, you will start to get more of like a creamy, lotion-like. It will begin to be stretchy. And as you are ovulating and your most fertile days, it will be more of an egg white. So a white egg white, slippery, wet, stretches, clear. Sometimes it can be streaked, but it's very watery, okay? We're talking about slip and slide here. It's definitely a difference from the other days. So it will follow usually this wave-like pattern of the dry, okay, follicular phase, okay, we're getting to the sticky, creamy, and then egg white, yay, we're fertile. So again, this is happening because it is your body supporting the chance for conception. Okay, it's all working together. When we are trying to keep track of our cervical fluids. I recommend keeping track of all of this stuff, pen to paper, in the beginning, just so you can really learn it. I will link at the end and send you to a site where you can download free graphs and things like that to fill everything out in. Otherwise, you can literally write on a piece of paper what day of your cycle you're on, the vaginal sensation. So along with each of these fluids, you'll have a different feeling in the vaginal tract as far as like you can feel when you're wet, right? So, and something to keep in mind, this is not talking about when you're turned on. If you get turned on by your partner and you're suddenly wet, doesn't mean you're, oh my gosh, I'm ovulating. That's a class for another day, but we're not talking about sexual arousal. We're talking about just fertility fluids at this point. So when you are tracking, you're writing the cycle day, you're writing the vaginal sensation, and then the cervical fluid description. Again, the more you write about this, the more you say, okay, it felt like this when I wiped, or on my fingers, it felt like this. The more details you give, the more you're learning. This is for you. Nobody should be opening up your journal and broadcasting on the internet. Try not to get embarrassed by this stuff. This is here for you to learn with. No beating around the bush, as my friend Brittany said. Let's get to it. The more we learn, the more power we have. Okay, this brings us to fertility sign number 3, which is our cervical position. So the cervix, like the temperature and like your cervical fluid, changes throughout the month. And this, as I said, is a wealth of information that is right at your fingertips. The cervix itself prepares for possible pregnancy each month by transforming into a perfect biological gate, which the sperm can pass through on its way to the egg. So you have all of these things in place, and I really just want to remind you that is the beauty of using these 3 fertility signs together, is because you don't have to rely on one. You can use, depending on the day or whatever, the information you need to really fully know your body. But how amazing is that you literally have a drawbridge inside of your uterus, and it's called your cervix. So the cervix, yes, it's part of your uterus. It's the lower part. It goes down into your vagina, and it raises and lowers depending on, again, hormones. So as your hormone cascade changes, so does your cervix. And here is exactly how that goes. So when you are not fertile, so it's going to be maybe like right after your period, you'll start to notice this as you examine your cervical position. But after your period and until you start, getting ready for ovulation, you're going to have a firm, low, closed and dry, non-wet cervix. So this is, you can just tell, it feels not fertile. Like it is dry, firm, right? Those aren't things we think of as like a luscious, fertile vitality thing. But as we become fertile and around ovulation, it softens, it opens, and it rises because of the estrogen, so that you can really like accept the sperm and go right towards a confident conception. So during those fertile days, it's going to be soft, high, open, wet. The acronym we use to remember that is SHOW, and that is a really easy way for you to remember. And you will be able to tell as you continue learning and examining this, around your non-fertile days, your cervix will feel similar to the tip of your nose. If you take your middle finger right now and just touch your nose, that is similar to how your cervix will feel, okay? As your hormones change and as you move into that super fertile time, take your middle finger and go from your nose down to your mouth and feel your lips. I'm feeling them. They're soft, right? And they're open, and sometimes, so you're feeling that difference. That's what you're looking for as you learn to do your cervical observations. That is what you're gonna see. So how do we examine our cervix? Well, again, we're gonna put on our big girl pants here, trim your nails, wash your hands, and use your middle finger. Usually this works best in a squatting position or a leg up in the shower. is usually how I do it. Whatever way is comfortable for you, and doing this as at least once a day once your period is over. You do not need to do this while you're bleeding. It's a pretty clear sign you're not fertile, but once you are done bleeding, go ahead and start checking this out. Try to do it around the same time every day. Again, like your basal body temperature, this is going to give you a better consistency, so and as you learn what you're looking for. Let's see here. I will make a note that if you have had a vaginal delivery, your cervix will always remain slightly open. It's one of the gifts, but you'll be able to tell the difference between your fertile and non-fertile days still. It's just not quite as tightly closed as it is before a vaginal birth. So you'll be able to tell that. And the cervical position too, I think, is one of like the easiest signs to learn, because it literally takes like a millisecond and you can do it at any point and get a pretty good idea of what the situation is. And yeah, I mean, I think it's just so easy. So a lot of people, it's a learning curve just to become more comfortable with yourself and your body. But I promise you, that's why I love using all three of these signs together, is because you can end up using, a combination of two or all three, or just one that you really like. So you have options. As with the basal body temperature, cervical position, and fluid, the more details, the more consistently you can track and write down or enter into an app what this is looking like, the more you will be able to learn, and the more you'll be able to look back on and really get a good rhythm with. So those are the three main fertility signs: basal body temperature, cervical position, and cervical fluid. I hope that I was able to give you at least a sneak peek into how to track those and why they're so amazing. I want to also touch on some of the secondary fertility signs that your body gives, because it is a good way, as you are learning, to have some supportive evidence. So some other ones that you may notice, I didn't add them all here, but ovulatory spotting, so a little bit of spotting on toilet paper or your underwear immediately following ovulation, pain or achiness near your ovaries, a fuller vaginal lips or swollen vulva, swollen lymph glands, specifically those on your pelvis, increased libido, abdominal bloating, water retention. So if you're feeling bloaty and puffy, it might be a good sign to get it on. Increased energy levels, just when you're like, I am feeling good. Heightened senses, specifically vision, smell, and taste. I think I've experienced this more than any other sign. Like, I can be at a grocery store and smell the pickle aisle like 3 aisles over if I am ovulating. Increased sensitivity in breasts and skin. So yes, to like pain in your breasts, but also like if you just feel like you're getting goosebumps all the time, or if like clothes feel really scratchy, those are all other signs that all of your hormones are like on high regard. So your body is gearing up for that possible conception. Okay, let's talk about some of the resources where you can track these, learn more about them, and also further your own goals of living fully fertile, however that might look for you. The book, Taking Charge of Your Fertility, is honestly, it is an oldie but a goodie. Most of the information in this webinar came directly from that book, and it is so amazing. It's a great resource, and I have yet to find one that is as easy to read and as useful as that one. So going along with that, there is tcoyf.com, takingchargeofyourfertility.com. This is a website that has all the free printouts you could ever want. I thought about making one and attaching it to this, but there's literally no point. It is perfect, and I don't like to reinvent the wheel. So go ahead to that site if you want to print off some free guides and things like that, if you want to do a pen to paper tracking of your fertility signs as you're getting to know them. When you are ready, or if you're like me and you're just a tech girl, you're ready to go, they have a great app. It's called Overgraph app, and it has the inputs for all of these fertility signs. Now, I also have used the Flow app and a few different other apps. Really, any good app should have a place for you to put in your basal body temperature, your cervical position, and your cervical fluid. If it doesn't have that spot, then it's mostly just relying on when your period ended and when the next one started, which is a start for tracking. But obviously, when we're really focused on trying to conceive or not getting pregnant, that's not enough information. So make sure you're using a resource that allows you to add as much information as possible. My number one resource that I would recommend is my preconception preparation membership. This is a 3-month, all inclusive, one on one membership. So, as a nutritional therapist, I view root cause symptoms for better health, better fertility, and a better life. And this preconception membership is my literal and figurative baby, but it is something I'm extremely passionate about, and I would love to have you be a part of it. So, this is a 3-month journey where we look directly at your own health. It's completely customized for you. So, you will be taking nutritional assessments. So, I know exactly what's going on in your health and body. And then we will work through different phases of preparation. So, definitely taking a look at exactly where you are in your own health, helping you remove the obstacles that are standing in your body's way of becoming fully fertile, checking your cycle, which includes an even deeper dive into all 3 of these fertility signs, um, finding out exactly what your body is asking for in order to be the most fertile, as well as some really great lifestyle and mindset and nutritional things for confident conception. So, taking you all the way through improving your egg quality, when to get pregnant, when to have sex to get pregnant, and actually helping the conception rates go up, as well as giving you support throughout your pregnancy. So that is something I'm extremely happy to offer, and I would love for you to be a part of it. Because I do work one-on-one with clients, I have a limited number of spots. So I would highly recommend you getting in touch with me as soon as possible so I can make sure to be able to get you in. If you would like to learn more about this, I do offer an absolutely free discovery call where we can talk through what it is that your body is asking for and make sure that I am the right fit for that. And I just want to thank you so much for being here. I know that time is a precious commodity, but me and your body thanks you because you are walking away from this enabled in a deeper way to know your body's rhythms and the tip of the iceberg for learning your body's really beautiful innate intelligence. So I'm so happy that you were here, and I would love to help you embody a fully fertile life. Please get in touch with me. My website is kyraoshea.com. You can also find me on Instagram at kyraoshea FNTP to learn more. And until next time, sweet one, take care.